The African landscape is changing. Despite decades of financial investment in healthcare, health outcomes in sub-Saharan Africa remain amongst the poorest in the world. For many, quality healthcare is inaccessible. The medical tourism industry is worth well over $1 billion, and fractured educational systems, inadequate job opportunities, and poor compensations contribute to a severe shortage of trained medical personnel. In Nigeria alone, it is estimated that approximately 2,000 medical doctors emigrate each year, with 80% of African landscape is changing, seeking despite decades of financial investment in healthcare is needed. Health outcomes in sub-Saharan Africa remain and effective leadership in the world.
Most doctors
for many, quality healthcare is inaccessible. The medical tourism industry is worth well over $1 billion, and fractured educational systems, inadequate job opportunities, and poor compensations contribute to a severe shortage of trained medical personnel. In Nigeria alone, it is estimated that approximately 2,000 The African landscape is changing. Despite decades of financial investment in healthcare, health outcomes in sub-Saharan Africa remain amongst the poorest in the world. For many, quality healthcare is inaccessible. The medical tourism industry is worth well over $1 billion, and fractured educational systems, inadequate job opportunities, and poor compensations contribute to a severe shortage of trained medical personnel. In Nigeria alone, it is estimated that approximately 2,000 medical doctors emigrate each year, with 80% of doctors within the country seeking work opportunities abroad. But what exactly is needed? Leadership. Strong and effective leadership.
Most doctors and other clinicians, as they progress in their career, tend to find themselves in leadership positions as executives without any formal training in what it takes to execute. From being a surgeon, all of a sudden you have to manage large budgets, you have to manage a diverse team of people who are non-clinical, and you find out that most people don't have that preparation.
The Healthcare Leadership Academy was established to support healthcare professionals unlock their leadership potential and develop the capabilities to drive transformative reform within their institutions. Our aim? To develop the next generation of healthcare leaders who excel in governance and service provision. Over the past 3 years, in Nigeria where our work has been piloted, we have trained over 250 healthcare professionals, from frontline clinicians to policymakers, and supported them to execute innovative change agendas within their workplace. Some of these projects have been run on a small scale in hospital departments, and some on a large scale involving whole regions. But all of these projects have sought to improve participants' job satisfaction and that of their peers and colleagues, person-centeredness within healthcare, the efficiency with which scarce resources are managed, and the design and management of processes.
I'm better off, I'm happier for attending the Healthcare Leadership Academy. And I would like to recommend this to everybody coming up in the healthcare profession, that this is a good course to go for. This is something that is highly needed, because like me, a lot of people feel that they are unable to be effective leaders, and this has certainly made a difference to me personally and to my practice here at Massey Street Children's Hospital.
Leveraging on the knowledge gathered from the patient-centered care program of the wonderful HLA people, Healthcare Leadership Academy, we were able to do quite a lot of projects. Find those projects, not all the projects are capital intensive. So we should not be scared of the fact that, okay, if I go for this program, in fact, the amount they are collecting as a fee for the program, from my own perspective, maybe somebody somewhere is sponsoring them, is too small compared with what you are going to benefit from the program.
Our programs are context specific and address the real life and evolving challenges participants face in their daily lives that hinder their delivery of world-class care. Our faculty are accessible and relatable. They include thought leaders, academics, clinicians, public health specialists.
Hello, PS. Hello, PS. How far? Good evening. I'm fine, thank you. Sorry.
I know. Okay.
Hi, sorry, I muted myself.
Okay. All right. Good evening, everyone. Good morning, depending also on your location. It's a pleasure to welcome everybody to today's conversation. Thank you. I hope it's pleasant where you are today, especially in the midst of all of the ongoing strike action by the Nigerian Association of Resident Doctors. We hear that over 11,000 resident doctors are currently on strike, indefinite strike for that matter, as a result of compounding issues. We hear over 19 pending issues that have not been resolved. You know, very, very tragic situation for our healthcare system, and we're hoping that those issues get resolved as quickly as possible so that our medical doctors can get back, to what they know how to do best. In the midst of all of those happenings, we are really excited to bring us a conversation today, which we believe would add value to the amazing work that you all do in your respective ecosystems. But before I continue, my name is Adidayo Falukun. I'm the program manager at the Healthcare Leadership Academy, and it's my pleasure to welcome everybody to the conversation today. By way of introduction, in today's healthcare landscape, the pressure on healthcare providers to deliver safe, efficient, and patient-centered care, while maintaining financial sustainability has never been greater. Just a short moment ago, I told you about the strike situation, and its impact on the bottom line of different healthcare institutions. I hear about 91 hospitals are being affected across the country. And what this means that is that the path to profitability isn't, just about cutting corners and trying to do things in a haphazard way. It's found in doing things better, both from our regulator's standpoint and, of course, the provider's standpoint, doing things better, doing things smarter, and more consistently in a way that delivers the best care to the population. And we believe that quality improvement is at the heart of delivering better quality of care to, those who need them and when they need them. And so by way of our session today, we're just looking to explore how quality improvement initiatives can transform care delivery across different touch points within our country and of course beyond. And today I have a very exciting guest on the conversation. For those of us that have been with HLA, you would definitely know her. But again, I will get to introduce her further down the line to just walk us through all of the things that we have lined up today. But in terms of housekeeping, just a few housekeeping before we go ahead. Please try to keep your mic muted, except if you want to make a contribution or ask a question. And please feel free to use the chat, and we'll be happy to follow the conversation in the chat if you have any questions right there. And you can also use the raised hand feature on your screen if you want to make a contribution or have a question to ask. The next, it's basically going to be our keynotes session. And to walk us through that today, I have a very distinguished guest. Dr. Noye is a healthcare quality improvement consultant and a technical advisor to governments with years of specialized experience in designing and implementing large-scale quality improvement programs across different healthcare systems. And she has a track record of driving measurable improvements across health systems with deep commitment to increasing access to quality healthcare through all tiers of healthcare governance in Nigeria. Furthermore, she has designed and led high-value donor-funded QI initiatives with substantial financial commitments adapted to various health market archetypes in Nigeria. Presently, she is the senior advisor quality and learning on the National Health Insurance Authority, the CIMONC program, and leading quality improvement initiatives in over 200 secondary and tertiary hospitals in Nigeria. She is an active member of the International Society for Quality in Healthcare, ISQUAR, and a faculty member healthcare quality improvement at HLA. She has a medicine and surgery degree from the University of Nigeria and a master's of science degree in global health and development from University College London. Dr. Naya, it's such a pleasure to have you back with us after a while. I hope it's pleasant where you are today. And if you can hear me, it's over to you. Always a pleasure to see you.
Thank you so much, Dayo, and the entire HLA team. It's a pleasure to be back and to really connect with us again. I'm excited today, especially because I know that it's another time to discuss quality. So when it's quality, then you'll catch me being excited. I'll be sharing my screen in a bit, and as soon as it comes up, please let me know that you can see it.
Yes, I can see it now.
Okay, perfect. I'll just put it on slideshow and then we'll go right into it. Before I start, good morning, good afternoon, good evening to everybody who is joining us at this time. I think it's really beautiful to have us all here at the same time. If you're joining from wherever it is in the world, just accept my greetings as good day. So we'll just run straight in. We're looking at quality improvements and looking at it as a business strategy. I'll just ask that you lend me your ears for the next, couple of minutes as we discuss this. Okay. So some of the things that I would really like to share, let's start off first of all with a few definitions so that it just helps us understand and give some perspective. When we hear quality improvement, particularly in healthcare, because you can have quality improvement in many places. In fact, it started traditionally from the aviation sector. So today we're actually talking about quality improvement in healthcare. Quality improvement is systematic. It's an approach, but it's a systematic approach. It's data-driven. So sometimes we say evidence-based. So it's a systematic, data-driven approach to enhancing the quality, the safety, and the efficiency of healthcare delivery. Yeah. It involves coordinated, continuous efforts by healthcare teams to drive measurable improvements in outcome. Now, I know that there's a lot of plenty grammar here, right? But I'll just bear with me and I'll help you with what we're taking away from here. And so to bring about measurable outcomes in patient measurable improvements in patient outcomes, in system performance and professional development. So what I want you to take from here, first of all, is that quality improvement is an approach. Yeah, it's not the end, it's not the beginning, it's the how. It's an approach. It's systematic, so there is a formula to it. And if you follow the formula, you will arrive at the same outcome. It's data guided or data driven. And the aim is to improve or enhance the quality, the safety, the efficiency of healthcare delivery. It's also important to note that the people who are driving this are the healthcare teams. And when we say healthcare teams, we're talking everyone who is relevant to the care of the patient. Doctors, the nurses, the midwives, the lab scientists, the lab technologists, depending on who is relevant to that patient's care per time. And the aim is that it will bring about improvements. But the beautiful thing about quality improvement is it will bring about measurable improvements. So improvements that you can measure in numbers, in percentages, in ratios, whatever it is. You can tell as a hospital provider, as a healthcare provider, a hospital owner, a healthcare worker, measurable improvements in patient outcomes, in system performance and professional development. So that said, it's important to note that there is definitely a lot of conversation around quality and how it's important to drive patient safety. That's usually the core. However, there is so much more about quality improvement beyond patient safety. One of them is operational efficiency. So, how does it improve the operations of the hospital, of the pharmacy, of whatever the healthcare provider is? How does it improve efficiency? How does it improve your reputation? How does it improve the money coming in? Profitability, particularly if you work in the private sector. We also know that high quality systems attract patients, and the truth is that many people will visit certain hospitals because of the quality of care provided. You know that the word goes around pretty fast when it comes to how you are treated in a hospital. For example, if you're a hospital that has a maternity section, so an obstetrics section, you deliver, babies, you help mothers deliver their babies, you have midwives, you have doctors, you conduct cesarean sections, which is probably what almost every facility in Nigeria does. Every hospital that provides that kind of care. Word goes around on the street pretty fast. And I'll give some examples as we go ahead. Dayo, please just help me to ensure that I don't go well, over my time. But we've had many cases where when a woman delivers her baby and she feels like she got, premium satisfaction for her money, you don't even need to talk too much about advertising your hospital, because those women over the next couple of months are going to put out word on the streets and say to their sisters, to their friends, to everyone who cares to hear, oh, that hospital treated me so well. Oh, they were so patient. They answered my questions, took care of my baby. The facility was clean. My goodness, I'm happy to go there again. But you see, when they come out of that place and they do not have some of these kinds of beautiful experiences, when they hear that somebody wants to go there, you're going to hear things like, don't go there. Don't go there. I regretted going there. And what that means for you is that you have lost another patient. You've lost another client. And if you're not careful, you can also lose investors and partners, because partners don't want to go anywhere. People don't want to invest their money in places where they're not sure. I'm sure a lot of us here who watch football have heard of athletes who, whenever they are into some kind of controversy, partners begin to withdraw. Even if the controversy is untrue, people just withdraw because they don't want to be associated with a brand that is pretty controversial, or it's, in the media for the wrong things. So it's also the same as long as you're providing a service and people are paying you for it. When there is poor quality of care, there's likely to be higher costs because sometimes you have things like long waiting times. People leave your hospital and they keep coming back because something happened, it wasn't managed well, they came back, nobody taught them, they leave, they come back. When they spend all of that money, they are not likely to return again. You see, there's also waste. We've worked with hospitals where there was a lot of wastage in the pharmacy section. A lot of drugs were going out of stock and they had no idea because the inventory was not on point. They didn't really know what was coming in and what was going on. And at a point, there were cartons and cartons of medicines that were going, to expire. And they didn't know how to manage that. And it was just because there was no systemic approach to solving that problem, to managing things like medicines inventory. Then there's also patient dissatisfaction. You don't want that. I think I've already mentioned that here. You don't want that as well. You want your patients happy because it's important that if they are happy, they're likely to come back with more people. They would let people know, oh, you should go there. That place is where you should go. So if you look at quality, what I'm driving at really is that quality improvement is traditionally important for patient safety. However, as a side effect, as a byproduct, as a balance measure, like we say in QI, quality can be part of your business strategy in your hospitals. Okay. And you want to think about it from different lenses. One of them is that you do not want to look at quality as something that you do because you want to tick the box. Okay, so you say, oh, they said we should do quality and we've attended some kind of training. Well, let's just do what they said we should do. When you do that, you will not harness the amazing benefits of quality improvement. You want to move from a compliance mindset. So you want to move from just complying and just ticking the box, running through the checklist, to looking at this as some kind of advantage, strategic advantage for your hospital. You want to treat quality as something that can drive growth, drive profits for you, drive better patient experience, better patient satisfaction, and not just a regulatory checkbox. You also want to integrate your quality goals into your existing strategy. You want to mainstream quality. Okay. Things like if you're working on, and HLA does an amazing job with some of the many courses that they offer. If you're working on, say, a particular quality improvement initiative, and you have targets, you want to ensure that your quality improvement targets are tied into your business and financial plans. You want to integrate these goals into the existing strategy, the existing plans of the hospital. So, for example, when Q4 or quarter 4 of 2025, what are your plans? We're preparing for 2026. What are your plans? And then what are your quality plans? How can quality help you drive your business strategy? Okay, so first of all, you want to move from ticking the boxes, which is compliance, to a strategic advantage. You want to integrate quality goals into an existing strategy. Okay, and like I mentioned, into your existing hospital strategies. You want to make quality part of everything and not a side gig. Thirdly, you also want to align the management of your hospital. So your board, management, clinical teams, you want everyone to be on the same page with your measurable outcomes. The idea is that there is accountability, whether it's with the CMD, the COO, CFO, head of the units, chief nursing officers, head of clinical, whatever it is, everybody has to understand that we're doing this thing and there is a shared accountability. I'll just throw in something here that has really been helpful, when we work with hospitals. We say to them, and they find this very useful, we say, ensure that you are mainstreaming quality. For example, when you have your mortality review meetings, you have your clinical meetings, you have your, all the numerous staff meetings in the hospital, those should be avenues, beautiful avenues for you to review your quality initiatives, for you to review your hospital's data, for you to review your performance metrics. Okay, it's not something that should be left at once. I'll just give another example. There was this private hospital, really large private hospital. It also runs IVFs and and co-fertility clinics, so it's really big. They have quite a large number of what you call them of clients and patients. I think at some point they were seeing almost about at the time maybe up to 500 to 600 deliveries in a month. Private hospital. And when we were working with this hospital, when I started to share the data with the CMD at that time, he was shocked. He said, "Do we do this number of cesarean sections?" And I said, "Sir, yes, you do." The reason he's shocked is because nobody is sitting down to look at the data. Everybody just, what, let's just do the work. Let's just do the work. Data is something that, don't worry, we're doing it. You don't do that. You want to mainstream quality improvement. You want to mainstream your data, your performance metrics. It should be discussed at your staff meetings, your hospital meetings. Your hospital meetings are not the time to only talk about punctuality, only talk about, who doesn't turn off the lights, only talk about, you get, it should be everything. And the final thing I want to mention is quality improvement also will improve your ROIs for you. And I think I've mentioned this because your profitability is important. Your revenue is important. Okay. It's not only the care of the patient. The care of the patient is front and center, and you must get that right. But indirectly, once you start investing in quality, and when we say investment, to be honest, we're not even talking millions. Many times it's really just being strategic about what it is that you want to do. When you invest in quality, you begin to reduce waste. You boost efficiency and enhance your profits. Another example I will give, worked with some hospitals at the time. What was the problem? Patients would register for antenatal care. They won't deliver in that hospital. At a time, antenatal care and registration was dwindling. By the time we came in and started doing, what we call like the 5 whys, trying to understand the root causes of these things, we found out that number one, the waiting times on ANC days are something else. Even if I was the one, I will not come back to that hospital. You come in the morning and you are there till well into the afternoon, going towards the evening. The pregnant woman is tired, she's fagged out. Over time, she doesn't come again. She finds another hospital that is much better and she goes away. And then we started working with them to understand. And the idea was, I think this one was a government hospital. Oh, the woman finishes from here. She has to trek all the way to this other place. And when she's done, she has to trek all the way to that other place. And when she's done, she goes all the way to the lab. And at every of these places, of course, there's a queue. It's not as if they're prioritizing the pregnant women. So she joins the same queue with everybody, with young people, with everyone, and everyone is shouting. And at the end of the day, she's fagged out. She hasn't had a proper lunch. She's just tired. And by the time we worked with them, we said, okay, we thought through so many things, and this is an entire thinking process. We came down to identifying the bottlenecks where they were, and we said, why don't we draw some people from the lab, some from the pharmacy? Again, this is not something you just copy and paste. This is based on carrying out a root cause analysis in your hospitals, which you can do, to be honest. And then we had a few people from the lab and come to the antenatal care hall. Guess what? In 2 hours, the average woman was done. The reviews from that quality improvement intervention were something else. Oh my goodness. Oh, we're so grateful. The nurses were so happy. I mean, at 1 o'clock, 1:30, they were done with ANC. And everybody was really glad. There was time on their hands. Patients were happy and everybody was glad. There was another time we worked with a hospital and they decided that they wanted to stagger their ANC. So just saying that when you apply quality improvement, particularly things like some of the tools, which we will not be talking about today, root cause analysis, and really going deep down to understand these things, you can solve problems for your hospital and you can rake in more revenue because your patients are happier. You you gain more time. Patient experience satisfaction is better. Your staff are happier. You gain much more time on your hands. You eliminate unnecessary waste. And that time you save, more patients can actually utilize that time. Because guess what? When people come and they get to the lab and the queues are long, what do you think happens? They leave, because if you were the one, you'd also leave. But if you do the right thing, you're able to stratify your patients. People come to the lab and it's just 2 people in front of them. They're happy to wait. When you come to the lab and your number is 55, already you are depressed, you see, and you lose money that way. If there's another lab somewhere offering better services, your people will leave immediately. Okay, so again, when we're looking at all of these things I'm mentioning and really thinking about how, clinical governance, clinical audits, and all of those things, and financial performance, your financial performance will improve when your errors are reduced, when you apply QI the right way. Many times, almost all of the time, things like patient errors are reduced to the minimum. I could give examples and examples, but I may not be able to do all of that on this webinar. But your errors are really reduced. Many of the medical errors that we have, when you apply quality improvement initiatives, you can begin to drop them. Okay. And things like length of stay is also optimized, because again, I just give you an example of an outpatient length of stay, which is like antenatal care waiting times. But there are also the ones for inpatients, where you can sit with these strategies, sit with them, and you can work them out in such a way that your patients do not have to spend all that time and they are unhappy on the beds. They're asking when they want to go. What should take them 5 days is taking them 10 days, all because your systems are not efficient. And guess what? When your systems are more efficient, this woman goes home 5 days, or this man goes home after 5 days, or 4 days, or 3 days. And I mean, they're happy to reunite with their families, but when they spend 10 days there, what happens? Sometimes they pick up extra infections. Nosocomial infections are picked up. Sometimes, I mean, there's just a whole lot. While I'm speaking, I recall an incident that happened at a hospital, and of course, I will not say the name. For some reason, the entire approach or the process from where the blood leaves the blood bank at the lab to, because there should be an SOP for that, so that irrespective of which healthcare worker is involved, the standard operating procedure would help. Now, this blood left the blood bank. For some reason, I don't know why it wasn't checked, who didn't check, and the wrong blood was administered to a woman who was in theater, whose surgery was already going well. It was administered while she was on the table, and she died within minutes. And that was when they realized that they just administered the wrong blood, for crying out loud. Somebody's mother, blood transfusion death, and that was it. Just like that. That would have been very simple. I know it's easy to say, oh no, why didn't the last person who, it's easy to shout, but it may not be that person. Any other person coming into that system can also falter, because you're depending on what the person knows in their head. Meanwhile, if you have a quality improvement strategy in your facility, then irrespective of who you employ, everybody just falls in line. Now, imagine when that news goes out and what it would do to the revenue of that hospital. Okay, what it will do to the profitability of that hospital. You and I already know the answers. It's going to drop. Which brings me to the last point. Patient trust will decrease if you don't do the right thing. But your financial performances will improve if your patient trust increases. So with this kind of example I gave, what do you think happens? Patient trust will decrease. And so you see how quality improvement, that systematic approach, that holistic thinking to improving things in your hospital, improving systems in your hospital, how it ties into better patient experience, better patient trust, improved reputation for yourself, and better profitability. Okay. When your patient trust begins to decrease, then there's a big problem. Big problem. In the next couple of weeks to months, it's going to show up in your revenue. And before you know it, you begin to struggle with your profits, struggle to pay staff, struggle to, paint the worn out areas in your facility, struggle to do this. And guess what? It's a vicious cycle. Once you struggle, you begin to cut corners, you begin to get cheaper options. Patients are seeing that. And as they see that, they are finding their way out to, somewhere else. So we've already identified, okay, that, when you do the right things, that data driven QI will help you to reveal gaps, and I gave some of those examples as I spoke. Identify waste, where waste is happening, whether it is a waste of time, waste of financial resources, waste of human resources. It will help you identify waste because there are many quality improvement tools for that. And these are simple tools that you can use. It will also help you identify opportunities for savings. Yes. So if you are well trained to do that, attending a good quality improvement course, or whatever it is, you would have the right capacity, technical capacity to know what to do. So now you can go back to your hospitals and say, no, this thing that we're doing this way does not work. This is a gap, this is waste, and this is an opportunity for us to, either make more money, save more money, do the right thing. But again, remember, what I want you to take away from this slide is that it is data driven. Okay, so everything is being tracked, and it's so interesting when you do this because everything is being tracked. You have data for everything. If you're someone, you can always report to your CMD. It even makes you look really good before your CMD. For the CMD, it makes your hospital look good before either your funders, your partners, your friends, colleagues, whatever it is, because you can speak in percentage. 47% of this, in the past 6 months, we've had, antenatal care improvement or a decline. So we know what to do. What happened in September? So it's really data driven. Okay. And you can use dashboards to track this, simple Excel dashboards to track this. Okay. So data-driven quality improvement is important. It will affect your patient outcomes, things around adverse events. Okay. Even your staff performance. When your staff are working in a place where there is zero wastage, better efficiency, people know what they're doing. They come in and they do it, and they know that everybody is aware, so there's accountability. Everybody's aware of the data. Everybody's looking at the data. Nobody's hiding. There's no, even lip service will not help you. Yeah. Eye service will not help you because the data will speak for itself. Okay. And then continuous feedback. So you look at the data this on Monday when you have your staff meeting, for example, on Friday, and you say, how did we fare this week? With that, you can say, no, we need to do this better. We need to do that better. Yeah. So let's look at a case study. I think that for this webinar, I can give well over 5 different case studies, but I'll just look at one. So this is 2015. Lagos State government or Lagos State had implemented the Nigeria Healthcare Quality Initiative. I knew of this initiative, and it was across different states in the country at the time. This was to improve maternal and newborn health outcomes. And there was an approach. The approach was adapting quality improvement strategies to suit or to fit the local context in the hospitals, strong governance, strong political commitment. You heard me mention healthcare teams in the beginning. So quality improvement hospital teams, implementing many change concepts and change ideas to improve care delivery. Don't worry, things like change concepts and change ideas are quality improvement terms, but these are really ideas that can drive improvement in your hospital. And like I mentioned, these are things within you and your facility. This is not, let's go and tar the road. This is not, let's buy $1 million. You'll be shocked. These are beautiful, small things within your facility that you can track. And what was the outcome or the impact for this? And this was measured even in percentages and in numbers and all of that. There was improved patient satisfaction, improved service quality, and this is through data-driven improvements. Their maternal and newborn health outcomes were improved. Okay, there was strong leadership and governance support that supported sustainable quality gains. So this also helped to build more trust. Okay, even among colleagues, partners, patients, and the rest of them. We put this one here, just to share with us, and you can see that you can see the link. You can see that this was actually published. There are a couple of some of these. In fact, I was looking at some of them in Nigeria, across Africa, so many, and I wanted to point out something else to us for this webinar. So a time is coming in Nigeria, and I know it will happen, where we will begin to have things like TripAdvisor websites. And I was thinking this hadn't happened until I saw a couple of them. Things like, you know how when you want to go on either a vacation or you want to travel somewhere, you check TripAdvisor and you check for reviews of hotels, and if you see a hotel that has a really terrible review, you don't want to go there because, I mean, nobody's going to pay for something that is going to be a disadvantage to them. Many countries outside here, so the UK, the US, Australia, and a couple of them already have this kind of public reviews for hospitals. So before a patient visits a hospital, all they need to do is go to that review and check. I know someone may be saying, well, if you have, your enemies can go there and go and write rubbish and this, that. I understand that bit, but I'm just trying to let us know that people are getting to that point where they want to see other patient reviews, how satisfied patients were before they pay, before they select that hospital for their HMO, for example, before they go there and pay out of pocket. And I didn't even know that some of these have already started in Nigeria. There's one I think I saw, is it Niger Patient or something like that? And a couple of them. And I know that in the next couple of years, as people own their voices, people are going to be more vocal about these kinds of things. We live in this sort of more vocal about these kinds of things, and people are going to be wanting to check out these kind of places before they invest their money. So it's something for us to really, really consider going forward. We just wanted to share this one here at this time. Okay. So again, like I mentioned, quality improvement it starts at the boardroom. Okay. And the executives must also, it's very important that the executives, excuse me, so when we talk the executives, we're talking the CMDs, the board people and everything. It's important that everybody is on the same page with quality, okay? And it's and this is because if they are not, it falls flat from the beginning. Everybody must agree that this is what they want to do. You want to set clear expectations for your quality goals. It must be clear. And you are discussing this at your staff meetings, at your executive meetings. You want to use data to inform decisions, strategic decisions. You want to use data to drive decisions. You're not making decisions without looking at the data. You want to reward continuous improvement. When you see that there is continuous improvement in a unit or in this or in that, you want to reward it. You want to call it out. You want to celebrate that kind of win. Okay. And leadership accountability would usually drive cultural change when everybody within that system sees that it's important to the CMD, it's important to the board, it's important to everybody. Then that's when we're talking about a cultural change. Yeah. Okay, so as we get to round up, before we go into our questions and answers, you want to make sure that your quality culture is sustainable. How can you do that? You want to make quality visible. In fact, we've helped hospitals to have visible dashboards, things like those who want to do digital can do digital, but even things like a show glass where you are tracking certain data and it's available for everyone to see. You mustn't show all your data. I know some of us may be saying, oh no, Dr. Nanya, we can't do that. But there are some that are visible, that should be visible to you and your staff. Let's not even talk about the patient, maybe you and your staff. Okay. And every Monday, every Wednesday or whatever, you go there and we can see, we went from 67 to 97. That's brilliant. How did we do this? So you want to make quality visible. You want to embed it into everyday operations, every meeting. It's part of what you're talking about, whether it's the nurses meeting, the doctors meeting, the staff meeting. It's part of everything that you're talking about. You want to train your staff on data use, patient-centered practices, critical. Very important. Where the staff now, and like I mentioned, these are not mighty things, these are not $1 million things. No, these are very small things that you can do, and you want to celebrate small wins. So as we round up, because this is really my last before we hand over to Daya for the questions and answers and how we want to take that. Quality improvement is a strategic business tool. We can make a business case for quality very clearly. Better clinical governance, strong clinical governance will help you with better financial outcomes. That's the truth. Data should be at the core of your foundation of improvement. All right. Leadership and accountability will sustain your revenue, sustain your profits. Very important. Because when everybody is on board, it's not just one person's thing, it's all of us that are doing it. And so finally, if you begin to invest in quality, you are investing in sustainability for your hospital, for your units, whatever it is that you're doing, you're investing in sustainability, and that's critical for you. I think we've come to the end. Before I hand over to Mr. Dio. So really, you want to start thinking about how your organization can turn their quality goals into measurable business outcomes. How can you do this? Those are the conversations you should be having at this time. Yeah. All right, I'll pause here. Dio, over to you.
Yeah, thank you very much, Ekene, for that insightful session. And you did talk about some very interesting conversations. I think you talked about mainstreaming of QI, the importance of mainstreaming QI, not just as a nice to do from a compliance standpoint, to a business strategy standpoint. And I had a question coming up from there, but I think we can start off from answering the question you have on the screen, and then I'll come back to the question around the integration of QI as a business strategy other than a compliance approach. So if you want to take this question on the screen first, and then we will take it from there. In the meantime, for those who have just joined us, where the conversation is how we can leverage quality improvement, not as a nice to do situation, but as a strategy for increasing profitability, especially in the very challenging times that we are living in within the healthcare ecosystem. Please feel free to ask your questions or drop your contributions in the chat, and we'll be happy to respond to that as we move along. Dr. Nair, do you want to answer the question on the screen first?
Yes, absolutely. Absolutely. So we'll start off. Okay, great. So I think the first thing is, and I'll just start up with this one. So I think the first thing is, what are the hospital's goals? Because some of the things we find when we work with hospitals, large, small, and this is across varied health market archetypes, whether it's hospitals in the north, in the south of Nigeria, in the west, in the east, faith-based hospitals, private hospitals, public, primary, secondary, tertiary, mixed archetypes. Trust me, I've seen it all. So the first thing you want to do really is, what are the hospital's goals? You need to sit down and look at your goals. What do we want to achieve as a hospital? Say 2026, say 2025, Q4. What do you want to do? Okay, what do you want to achieve? And what are your business goals really? How do you want to improve your revenue? By 50%, by 20%, by 80%? What part of your revenue? And we can, to be honest, this is something that if you do as a hospital, you're doing yourself a beautiful service. What part of your hospital helps you with revenue? Yeah. Is it the maternity? Is it the lab? Is it the, what is it? So you need to understand. So really be clear, first of all. Look at your hospital and look at your ANC, look at your surgery department, look at what helps you with revenue. Okay. Outline all of that clearly. And then you want to ask yourself, how can I begin to improve? What are my quality goals for these areas? Okay. What are the challenges? And usually QI tools will help you. What are the challenges that we're experiencing? What are the bottlenecks? And then what are the quality goals that we want to achieve in these areas? So in the ANC that is giving us so and so amount every month, for example, what can we do within that ANC place that will help us to drive measurable outcomes? That's the first thing you want to do. So be clear on your goals. That's the first one. And then be clear on your quality goals as well to help you drive it. And then you now want to begin to look at both of them and say, what is it that we can do within these quality goals that will tie directly or indirectly to improving patient outcomes, or improving our efficiency as a hospital? Because those are the things. Remember the slide, let me go back there. The slide that talked about financial. I hope everyone can still see my screen. Great. Okay, you want to look at things like this. So, am I reducing errors? Where are the areas in my hospital where errors are still rife? How can we reduce them? How can we reduce length of stay? How can we optimize it? Not just reduce, but how can we optimize it? If a patient shouldn't stay 10 days, then they shouldn't. Yeah. How can we optimize it? And then length of stay for your outpatients as well. How long do they spend waiting, wasted man hours in the hospital? Instead of saying to them, even if you're in the UK, you will wait. Don't do that. So your colleagues who are helping them in other hospitals are raking in more money than you. You see, how can you then improve your patient trust? So those are the things you want to look at. So I think to answer this question, the first thing is be clear on your hospital's goals, your hospital's business goals, be clear on that. Be clear on your quality goals for your departments as a hospital and for your departments. And then based on that, you want to begin to link them. Again, looking at the slide I just shared, you want to see how you can reduce your errors, how you can get your patients to love your hospital, love your system a whole lot. And then what was the third one now? Sorry, let me find that one. That second one. And then how you can improve and optimize length of stay. Patients can see that you are very efficient. If your ward rounds are 8 o'clock, they are 8 o'clock, and you do that as much as possible. If you do these things and you track them, if you do these things I mentioned and you track them, you're going to be able to get your organization to begin to record measurable business outcomes. Yeah, I'll stop here.
Excellent, Dr. Naya. Thank you for that question, for answering that question. While you were speaking initially, you talked about the role of leadership, in ensuring that we incorporate QI, not just as a nice to do. But one of the things, again, that a lot of times leaders within the healthcare space are pressed with is how do you show progress, profitable progress, by just investing in QI. And sometimes they see QI as a cost center rather than a revenue generating strategy. So how do you, if there are leaders here on the call, how do you get leaders and managers within healthcare space to make that mental shift? You said QI is about an approach, right? It's not necessarily, again, what you begin to do. It's just an approach. How do you get them to shift their mindset from seeing QI as a cost center to a revenue generating activity within the organization?
Okay, thank you, Dayo. I think that's an excellent question, to be honest. I would say that, first of all, they need to start small. Low-hanging fruits are the best bet. That's what I have seen working with hospital leaders over the years. Usually I get that. I've even had people say, Dr. Noya, leave this thing. This is not the UK, please. This is not the NHS. And I say, you know what? Start small. Once the results start coming in, immediately people begin to shift their mindset. You don't need to preach a lot. Once the results begin to show for themselves, I've had hospitals where we work with, and then within, say, 5 weeks, we're tracking patient experience and satisfaction. And then the patient experience begins to come back, and you hear what patients are saying. You plot this on a graph, you show the MD. The MD is like, what? Okay, what was that other thing you said we were supposed to do? Please bring the file. I think we need to look into this. So I would say that results speak for themselves. Start small, and when you start small, track those results, share them with the relevant stakeholders, people who need to see these things, and you'll be shocked. Another thing why it's really important is because remember, I mean, this is 2025. This is the world post-COVID. There's a lot happening at this point. Nobody should be stuck in the rut, nobody should be stuck under a rock. The world is global.
Yeah.
Sometimes you have, depending on how you position your hospital, position yourself online, in the media, wherever, you will begin to attract certain kind of people. Somebody may be coming back from the US. Oh, well, I'm going to be back for about a year. I'm an orthopedic surgeon who works in Texas. There's something I see. I see your hospital, can we have a conversation? Do you see? When you position yourself, not just with the fluff, because the fluff is, our hospital was excited to welcome the commissioner. Okay, that's good. What next? Our hospital did this. What next? But there's a kind of way you can showcase data. And I'm not talking patients, data, but you can begin to share some things around your hospital. You will, and you put it out there, you will definitely begin to attract certain people. People will come into your DM and hello, can we have a chat over something? Do you have 15 minutes? I just want to. It's from those I just want to's. And before you know it, you've partnered with someone in Saudi Arabia, you've partnered with somebody in the Middle East, someone in Germany. And before you can say Jack Robinson, you start hearing things like, well, we have this refurbished equipment, really good, to be honest, and we were looking for a way to maybe dispose. If that's something we could ship them down, you can only pay us 20%. Do you understand what I mean? So those kinds of things begin to come in when you position yourself right, particularly if you're looking at your hospital as something that will grow, sustain, be a big name, and do a lot of stuff. You can't joke with quality, to be honest.
Brilliant. Thank you again, Dr. Naya, for that. Just looking to see if anybody has any questions. Any hands up before I take the next question? Does anybody have any question or burning contribution to make in the light of all that has been said so far? Think we still have time to just take one final question. Okay, let me see. I don't see any hand up. It's been a quiet day from our participants so far. I guess it's because we're in the weekend and evening time in Nigeria. My last question for you, Dr. Noye, you talked about showcasing and having that sort of um dashboard. I mean, with respect to data, having visible dashboards for tracking data, like, give an example like a show board and all of that, right? But we know that barriers do exist. You mentioned one of them to say, oh, some hospitals wouldn't want people, other stakeholders to see what certain metrics are within the hospital. What other barriers do you see um, within teams, preventing them from showcasing data in a way that helps everybody rally around the important things that needs to be done to move the hospital forward in terms of performance and then profitability?
See, okay, good question. Good question. Sometimes, I mean, there are many barriers. Sometimes sometimes the barriers are not factual, they are perceived.
Mm.
Sometimes it's just fear. Oh, you can't say, oh, don't expose this, don't push it out there. You never know. And what we say is stratify your data. There are some data metrics that should be visible to you, the MD, the staff, everybody within the hospital should be seeing this on a daily basis. And you have those papers there or those tables there, and you're just plotting them. and you can put them there. I have seen hospitals that started, because everybody was a bit afraid, no problem. Then look at what they did. So they started off with patient experiences. They took patient feedback seriously. When you're going out, you can just scribble and let us know what you think about our service, that kind of thing. And they found out that patients were complaining about a particular toilet. You see, nobody even knew that, oh, I don't know what was happening in that toilet. And the mothers were complaining, about that toilet. There was a consistent complaint. Sorry, okay, so there was a consistent complaint about the toilet. I wasn't sure whether I was leaking or something, and the MD didn't know. And when patients began to write, it was a big problem for the mothers. So people were already saying things like, look, if this thing is not sorted out, we're not, this, that. Let me say, what's happening with this place? You see, and by the time they found out and fixed it, they now shared that data on the show board, that data of that toilet. So it was something like, you complained about this over the past how many weeks or whatever in October. This is November. We have fixed it. We're excited. Do you see, that is data to let you know that this is now working. So it's there for patients to see. And you see patients walking and say, they fixed that toilet. So see, they said it, they fixed. Do you see? So the hospital now started learning how to share what can be shared, initially over time. But after that time, you started building faith and all. Some hospitals went, that I could go on and on. Some hospitals started things that look like PTA meetings with their patients. Yes. So things that look like PTA meetings with their patients, where the hospitals are working very closely with the patients and some of their patients, not everyone, but some of their patients, to improve hospital outcomes. So certain patients, they will call them, sit with them, have that conversation. And before you could say, patients were speaking truth, this is what we think, this is what we think. They started saying as their hospital, we think that we can, we think that we can, so patients were helping. I would stop with this example of sharing your data. This hospital was a private facility, partly mission funded, but patients pay out of pocket. So it's fully private, for profit. They were holding antenatal care in a room when we met them. They started with QI initiatives. That hospital took ANC attendance from one room, Mr. Dio, to two canopies outside. You know what that kind of revenue will do for the hospital?
Wow.
Women will come in droves. Two canopies.
Absolutely.
I remember coming one day and I couldn't walk into the hospital because of space. And it was antenatal care day. Why? It was just quality. Sharing these things. Women they had a WhatsApp group that they were almost taking to Telegram because it was full and packed. It was a quality improvement initiative on WhatsApp. At a point, as I speak to you, Dayo, I know that hospital, they have an extension in the compound. They are building another massive structure in their big compound. Because as soon as they started their QI initiatives, everything just went from here to here. Patients' trust improved, the data improved. There was a time I was on the WhatsApp group, so I could see what patients were saying. Patients, they were always commending the sisters, we were doing this, doing that. So just saying that, let's not run away from data and the barriers with sharing data. You can stratify your data and allow some people to see certain things. It shows them that you're thinking about what you're doing and you also trust them enough to carry them along in that journey.
Excellent. Thank you again, Dr. Enaya, for bringing practicality to the questions you've answered. And I think that sort of brings us to the end of this segment. I want to thank you once again for all your resourcefulness in the last hour or thereabout, just walking us through QI as an important cog that helps drive hospital profitability going forward. And we would take a brief program update right now. Before then, I do see a question in the chat from Deborah. Deborah is asking if we're going to get a certificate. Unfortunately, not for this session, but if you do come for the patient-centered care program, which I will talk about in a moment, you are definitely going to get a certificate. Dr. Naya, again, we're just going to, if you're happy to stay on, because again, we have a session with you for the PCC. If you don't mind, maybe a few minutes before you drop off the call. In terms of our upcoming programs, we do have the Healthcare Board Governance Program coming up within the next 2 weeks. November 14th is the start date. And so this program is designed for management team, CEO, and the board members, and even aspiring healthcare practitioners or professionals who desire to develop competencies around financial management and strengthening of accountability, with a view to understanding the corporate governance dimension of hospital management, what it takes to build good board structure and function. And so if you're looking to really position yourself to assume directorship positions within healthcare organizations, this is a program you would like to take. And we do have a 15% discount for bulk registrations. And as well, we'll be giving a 10% discount for people that want to register directly from this call. So Paul, if you could put the link in the chat for those who might be interested in enrolling, you can take advantage of the discounts right away. The second program, of course, is the patient-centered care program, which Dr. Noye has really been championing with the Healthcare Leadership Academy over the past 3 to 4 years, I believe. During this program, she will delve more into UI. Some of the things she talked about will be going, doing a deep dive into all of those, some of the principles and practices involved in QI. We'll talk about principles of medical law and ethics, and then beliefs, cultural intelligence, and communication. This program will be starting November 21st, and it's for 150,000 naira. So if you want to also take advantage of that, you could get a discount. You will get a discount today if you enroll after the program. And then the next one is the Healthcare Financial Management Program, which is for mid-level to senior level managers and accountants, those that make financial decisions essentially within healthcare organizations. During this program, we'll talk about the fundamentals of accounting concepts and procedures, what it takes to manage and allocate financial resources effectively, and then how you can measure the financial performance of your healthcare organization vis-a-vis all the strategic investments you've made, and all the other considerations that you need to have. This program will start, is our last program, I believe, for the year. It will start on the 5th of December, about a month from today. And it's going to run for 4 weeks. And we're also giving a 10% discount to anyone who's going to register today for this program. Just a few testimonials from our past participants and some of our alumni. Dr. Selma Yahaya once said that she, a year and a half after she completed the HFM workshop, our facility has recorded 100% increase in facility treatments. And you can imagine what that means for their profits. The profit margin has increased, and we have taken intentional steps to minimize our losses. And secondly, she says she can now pick out accounting errors even as a non-finance person, which is great, right? During the HFM program, we are not training healthcare providers to become financial managers. We're training them to become better at providing oversight to their practice while they focus on the clinical part of the work that they do, which is the most important. So that's about it in terms of our outlay today. The links to our program has already been dropped in the chat. Please feel free to take advantage of the discounts that we already have flying. I'm just being told now that you can actually get up to 20% discount if you enroll today, which I think it's a bargain, given the value that you will get from this session. Paul, is there any other thing I'm missing out here before we wrap it up for today? Okay, no. Okay, great. Again, thank you everyone for attending today. The recording for this session will be made available. So if you have participants from your facility who would like to listen in, or who you would like them to glean insights from what I've been shared today, please look up for email on the recording of this session. I also want to take the medium to appreciate Dr. Nair. Every time we call, you always answer. We do not take that for granted. Thank you for your resourcefulness and the insights that you've shared in the last 1 hour for this session. We do hope to connect with you soon. And well done for the amazing work you're doing with the CMONK program. We see lots of updates on LinkedIn and other social media platforms. It's a pleasure to always have you around. Okay, excellent. Thank you everyone for joining us today. Thank you, Paul, for providing robust support, tech support, and all of that, ensuring that everything goes well. From the HLA team here, it's thank you again, and have a wonderful rest of your weekend. Bye-bye for now. Cheers.